I would like to welcome you all to the OVA Circle, which is a platform about empowering women navigating midlife. By midlife, I mean the journey towards menopause and beyond. Today, I have Dr. Kenya here with me, who's going to introduce us to all things menopause. And I would just like her to just go for it. The reason, actually, first of all, let me just touch on the reason behind this conversation is because throughout my journey, it's a personal challenge I faced navigating perimenopause and menopause, and I discovered that there is really a lack of awareness, conversation, and community around it. So that's the inspiration behind the OVA Circle. Today's episode is proudly sponsored by Verushka Wigs. Verushka Wigs is a Kenyan wig brand that empowers women to feel beautiful and confident. Welcome, Dr. Amanda Kenya.
Thank you very much. And thanks for having me on and allowing me to be a part of this OVA Circle movement, which has been so revelational and just wonderful for me. So just a brief introduction. I'm Dr. Amanda Kenya. I'm an obstetrician and gynecologist, and I have a special interest in menopause. And that is why I'm here today.
All right. Thank you for coming. And I'm so glad that you agreed to be part of the OVA Circle. So I'd like to just start with the general and basic definition of menopause. I just want us to have it broken down in simple and easy terms to understand. What is menopause?
So menopause, medically speaking, is when you have gone 12 months without a period.
So basically, menopause is the day that marks 12 months without a period.
Right.
So basically, menopause is just like that single day.
Yes.
Okay, so...
And if you happen not to have a uterus, because maybe it was removed earlier due to fibroids or whatever, you won't be able to use that definition. So we say in your case, menopause will be when you start experiencing hot flashes, however long it's been since that surgery. Yeah.
Okay, great. So menopause is the day that marks 12 months without a period.
Yeah.
And then how about perimenopause?
Perimenopause is the transition period that women go through before reaching that 12 months. So it can be anywhere from 4 to 8 or even 10 years before your last period. And it's often marked by symptoms which are common in menopause. So you start experiencing the menopause symptoms way earlier.
All right. So these menopause symptoms are experienced before menopause, right?
Yes.
And around what age does the perimenopause period begin? Because this is what, I did not even know perimenopause exists.
Right.
I knew that as women, we will get to menopause, the period stops, and there's hot flashes after that.
You didn't know it could happen before.
I did not know it could happen before. I was not aware about the symptoms that I would experience or what to expect. And that's the reason behind this whole entire conversation, because some of the symptoms can be challenging for a lot of women. And maybe you can take us through the kind of symptoms that women could experience. And also from what age does perimenopause start?
So usually it starts at around 40 to 45. But many women now are experiencing perimenopause even much earlier, like 38 or even 35. Right? So there's really no age per se. If you feel like you're having symptoms that could be perimenopause, see a gynae and get a diagnosis, because it could also be early menopause creeping in. So some of the symptoms, as I'm sure you know, or why don't we start by saying the symptoms that you experienced? And then I can add.
Okay. So at the time when I was experiencing my symptoms, I was not aware that these are perimenopausal symptoms. I'm 46 years old now, and I'm looking back, I actually think that I started getting perimenopausal symptoms around 40. And these were like irregular periods, erratic mood swings, which I could not really understand because I've never really had like really bad PMS. I started getting cramps, which I never experienced before. But irregular periods was the main symptom, and I just thought, it's just one of those things. And then as time went by, I noticed I was having like sudden heat on my face. And I just thought I was hot, because I was like, I'm only 40. I was not thinking about menopause, right? And then as I started to do a little bit more research, especially because of the irregular period, then that's when I came about. I started seeing perimenopause all over social media, and those are some of the symptoms.
Yeah. Okay, so first, before talking about more symptoms, I want to say that perimenopause and menopause is basically whereby your ovarian function is starting to decline. Okay, so your hormones, particularly estrogen, is up and down, and all over the body, most organs have receptors for estrogen, which means that estrogen affects most organs in the body, head to toe. So when we're talking about symptoms, we can go head to toe. So we can start with the brain. Let's start with the psychological aspects first. Perimenopause can present with symptoms of depression or low mood, anxiety.
That one. Yes, that
you had
too.
Low mood.
Yes.
It's quite common, and many women don't attribute it to their age. Anxiety.
Even that.
If you had ADHD and it was undiagnosed earlier, it's probably going to be diagnosed at that age now because things are harder for you to manage. And then apart from the psychological issues, there is the actual cognitive function. So we have brain fog creeping in. You just can't find the word you're looking for. Things that you used to find easy to do are taking a bit more time. Your work performance is declining. And then apart from that, as we come, we're still on the head.
Yes, we are still on the
hair
head.
loss and shedding and hair thinning and drying. Very dry skin on the scalp and the face and the ears, so dry that your ears can be
itching
itchy.
of the ears, yes,
right?
yes.
And then coming lower down, we have the heart. Estrogen is protective for the heart. So during perimenopause, you can have palpitations. You can have an increased risk of heart disease in the perimenopause and menopause period. It can affect your lungs. You can have a new onset asthma as a 40-year-old.
Are you serious?
Yeah.
Wow.
And just random shortness of breathing that can't be explained. When we come lower down to the gut, you can have irritable bowel syndrome, random constipation and diarrhea that's just not adding up, lots of bloating and very slow digestion, nausea. Then we come lower down, where we're still in the abdomen, you can have an increase of fat just in the central portion, right? Despite not changing your diet or your physical activity, you just suddenly feel like you're putting on weight. And then lower down, it can affect your bladder function and cause you to have what we call incontinence, which means you pee on yourself a little bit when you cough or when you do something strenuous. It can cause what we call genitourinary syndrome of menopause, which is the genital tract and the urinary tract. So you can get recurrent UTIs, you can get vaginal dryness and pain and irritation. This can also be made worse by having intercourse, and you can just be very uncomfortable down there. Your labia and your vulva can become very dry and itchy, irritated and thin. And your labia minora can actually disappear and be absorbed by your body because there's no estrogen keeping things plump and down there.
Okay.
Right. And then lower down, you can have joint pains like your knees and muscle aches everywhere, which is more common in our population than abroad. I think, the dryness can even affect your skin and your nails. And you can find, you used to have really nice long nails and now they're just chipping. You can have little ridges forming on your nails. So there's so many symptoms.
I wanted to ask you to stop because this sounds totally overwhelming.
I know, right?
And it's crazy that none of us were prepared or are prepared for the transition towards menopause. And that's the reason behind the OVA Circle, because again, once you're aware and educated, you become empowered. And once you know what to expect, it doesn't even feel that bad to start with. And when you have a community of women,
that's the best part.
So all the symptoms you've mentioned, you're part of the community. You've seen, and I'm just listening to you, and it's exactly the same symptoms the women on the platform are talking about. And they're just so glad that they're not alone. All right. I know the symptoms may sound like many and overwhelming.
I haven't even mentioned half, by the way.
Yes. However, the force behind this conversation is to let women know that even though that these symptoms could happen or can happen during the menopause transition, it's not all feared. It's not, you're not hopeless. Yes. There's something that can be done about it. So today I want us to talk about the natural ways that someone experiencing these symptoms can manage them. Like there's strategies on how they can navigate and approach the perimenopausal symptoms depending on what someone is dealing with. So I mean, could you broadly take us through? We're not going to like talk about each and every symptom, but I'm sure there's some foundational principles that would help,
like generally,
that would help make the transition less difficult. Yeah,
for sure. Okay, so even though we're going to talk about medical treatments, the foundation of management of perimenopause and menopause is lifestyle modification.
Right.
So having those really early perimenopausal symptoms is kind of like a trigger for us to focus more on our health and prepare ourselves for what's coming in the future. So one of the things we want to do is work on is our nutrition.
Right.
Yeah. It would not be making much sense for you to be on hormone therapy later and not doing and eating unhealthy, right? So we want to have a whole food diet, basically. We want to avoid processed foods. We want to have whole grains, fruits, avoiding saturated fats, only healthy fats, olive oil and nuts. We want to eat lots of plants. We want lots of protein and fiber in our diet to help with our digestion. So also, even in the diet, we want to avoid triggers, right? So it might take you some time to figure out what triggers you. But some people figure that like spicy food triggers them. When they take coffee, it triggers their hot flashes and their insomnia. Alcohol is a trigger as well. Smoking can be a trigger as well. And then exercise, physical activity, right? It does help. Most people are like, okay, so you're telling me if I go for a walk, my hot flashes will stop. No, but I'm saying that if you get to a point where you're healthy, you might have a reduction in your symptoms, right?
Right. So building that good foundation could help ease your symptoms as you transition towards menopause, right? Because what I'm hearing you saying is you could throw all the medications at yourself and at your symptoms, but if you don't have your foundation in check, then it might not really help in the long run.
Be so useful.
So the beginning of menopause or the transition or perimenopause is like, the universe telling you, check engine. Get your ducks in a row. Which I think we can look at in a positive way. Because we are aging anyway.
We are. And we're blessed enough to be aging, right? Any woman who is blessed enough to live long enough will experience perimenopause and menopause. It's inevitable. And many of us are going to spend a third or even half of our lives post-menopause. So why don't we give ourselves the best fighting chance?
Yes, right. Yeah. Okay, that's great. Okay, so you talked about exercise as well.
About exercise. Not just...
So when it comes to exercise, you mentioned walking. But apart from walking, what other exercises would you recommend?
In the perimenopausal period, the main kind of exercise we actually need is resistance training and lifting weights.
So strength training.
Right. We want to build muscle because the muscle metabolizes glucose and it also protects our bones. And we know our bones might get weaker as the years go by. And so we need a good covering of our bones and protection to take us through to those years. I'm sure you've seen lots of older ladies who are very frail.
Is that called sarcopenia? Is that the same definition? Muscle loss?
Muscle loss. And also most likely they also have osteoporosis, which is bone loss. And so even the littlest fall will give you a fracture of the hip or anywhere, and it can take very long to heal.
It's usually downhill from there. Once a hip fracture, it takes really long to recover. And then it just triggers a series of other issues as well, is what I've realized. Yeah.
That's true. After menopause, a hip fracture for a woman will give her about a 50% 5-year survival rate.
Wow.
Right? Because now you're immobile, you're prone to infections. There's just so much going on, and it's really hard to recover from that. So we don't want to get there. So the specific kind of exercise we're looking at is resistance training and strength training. That doesn't mean you have to go to a gym and sign up and start lifting the heaviest weights in the world. You can start small at home with your little dumbbells and watching videos and just try and start building some muscle.
Yeah. So by strength training, it's just trying to condition your body to lift heavier and heavier each time, so that you're getting stronger. That's just basically it. Okay, so we have nutrition, exercise. Are there any natural, or I'd say non-hormonal recommendations that you can give apart from nutrition and exercise?
There are some supplements that have been found to be useful. For specific symptoms. So, for example, to keep your brain healthy and to help with sleep and relaxation, you can try magnesium at night. Ashwagandha is great for sleep. What else? Vitamin D, it's good to get your vitamin D levels checked.
Right.
If it's low, definitely supplement vitamin B12.
Right, yes.
If you're losing hair, saw palmetto is great. Pumpkin seed oil. So you see, there are like so many supplements in the world, and many of them are useful. But that doesn't mean you have to be on all of them.
Exactly,
so what I like to do is just go through your main major complaints, go through your labs and see what you're deficient in, and then figure out like maybe 3 or 4 supplements that you can try for some time.
That can start as your foundation. On which you can build up on later if you need to, depending on what symptom you're struggling with.
But not just jumping in and taking a bunch of stuff.
Because more is not better when it comes to supplementation. Okay.
That's true.
All right. So nutrition. Exercise, supplementation. I have read that stress management is also really key. I've noticed that in my journey myself. But I'm going to take you back. When you talk about nutrition, when you mentioned caffeine and alcohol triggering hot flashes, that's another symptom. I noticed. But when I took out the alcohol, the hot flashes completely went away. So I think...
And how hard was that to do?
It was easy because also the hangovers were getting worse and worse. And so I was like, quality of life is better than having a drink. So, yes. So, what is it? I lost my train of thought. This is brain fog.
We finished talking. You were talking about stress management.
Stress management. I've read that stress management is really, really key.
It is key. And I send all my patients to women's psychiatrists just to get an assessment, because you find you've been going through these years of these symptoms. It has affected your social life, your relationships with your partner, your children, your friends. There's a lot of turmoil going on that you may not even know. Maybe it's not at the surface. And so having a mental health assessment and just talking about how you're feeling and what's going on and maybe coming up with some coping mechanisms is really useful. And being mindful and, doing breathing exercises and just keeping your mind healthy.
Is it possible to carry stress without knowing it?
Definitely. And it can show in other ways. It can show in your skin. It can make your symptoms literally worse. It can show in your weight.
Right.
Yeah.
Okay. So, all right. So, are there any other non-hormonal treatments
for specific symptoms? There are. For example, if there are certain antidepressants we use, not just for depression or low mood, but they have been found to be helpful with the vasomotor symptoms. That's the hot flashes and the night sweats. So there are specific ones that we use if you don't want to use hormones. So those are the non-hormonal ones. There are other drugs like a medication called gabapentin, which is typically used for nerve pain and migraines, but it has been found to be useful for hot flashes and night sweats. So sometimes that can be prescribed. And then there are other specific drugs, like there's a medication called clonidine, there's oxybutynine, and all these. Obviously, you would not start on your own. It would be a conversation with your doctor about the non-hormonal options. And those are there. They are.
Okay. So for a woman listening to this conversation, where would you advise her to start? Yeah, let's say she's like in her late 30s or early 40s and something just doesn't feel right. Yeah. Does keeping a journal of your symptoms help? At what point should she go to a medical profession? And and like where does she start? Like, what should she look out for? Is it the symptoms that we've mentioned, or which are the key symptoms? Because we did talk about a long list of symptoms. So are there some that really are key that, okay, this is happening? Is it the period becoming irregular from regular? So what should women like look out for? And then do they keep a journal? What are the steps that you would advise them to follow? Yeah.
Okay. So first of all, you can go and see a doctor at any point, right? You don't have to wait for anything. And there also I'm glad you asked that question. I wouldn't say that there are any key symptoms that would make you suspect that you're going into perimenopause. Because one of the symptoms is literally not feeling like myself. That's a symptom.
Oh yeah, that's so when you're just not feeling
like I just don't feel like myself. That's a very common term that women use to describe how they feel in the perimenopausal period. So if you feel like that and you feel like you really want to get help, you can see a gyna. It would be great if you could see a gynecologist who is, experienced with dealing with perimenopause and menopause. But it would be much better if you went with a symptom journal. Right. So you mentioned tracking. You can track your period. So we all have the period apps. Well, not all, but many people do. It would be great if you could get one, track your period so we can see exactly how irregular it is, what's going on. And then it would be good if you could also track how you're feeling on each day. Of your cycle.
Oh, so your emotional state.
Your emotional state, even your physical state. Like, maybe you're writing a short journal in the morning. I slept terribly. I woke up 3 times because of night sweats, blah, blah, blah. You can do that for a couple of months so that when you go and see a gynecologist, you have it written out and you can now objectively assess the severity of your symptoms, because that's going to direct the treatment.
Okay. Would birth control affect perimenopause or how a woman experiences perimenopause?
Yeah, it would. And birth control, the pill, is actually a treatment for perimenopause. It's one of the treatments for the perimenopausal period because it helps with the vasomotor symptoms. It makes your period regular and it basically helps you feel a bit better during that period. It's suppressing your own ovarian function and providing you with estrogen and progesterone, which you need to feel better. So it does work and it doubles up as contraception. So you might be on birth control before the perimenopausal period and going to perimenopause and you might not know until you stop.
Until you stop because you're already...
Your period is regular. It's helping your mood.
Okay, so some women who are already on birth control may be going through the menopause transition, but they are not aware because they're already on birth control. Okay, that's it's good for you that you pointed that out. That's interesting. Okay. So we're gonna talk about hormonal replacement therapy later. For this episode, I just wanted us to touch on non-hormonal treatments or what I'd call natural treatments, but there's also medication that is non-hormonal. You've mentioned those, but those are only prescribed by a doctor, right?
Yeah.
Okay. All right. By speaking to you, I feel like some of the symptoms you mentioned are some that I've experienced myself, right? And something that you mentioned also stuck out to me, going to gynecologist who is experienced in treating or dealing with women going through the menopause transition. Because it may not be that easy to go to your doctor and just say, I don't feel like myself, because
you booked a whole appointment to tell me that.
Yeah, right. Because a lot of women feel that they will not get heard, and they feel like they're not being seen. And this is something that I've come to learn that is a real experience for many women out there. Yeah, but through awareness and educating women, at least and doctors, the information will empower them to advocate for themselves.
Absolutely.
So I think what I hear you saying is encouraging women to advocate for themselves.
Yes, please do.
Yeah.
And remember that we were not taught this stuff in school, right?
I like that. Yeah.
We had to go the extra mile and do the necessary education to be able to stop failing women, right?
Yes.
Even I think the education on menopause.
Yeah, what did you get?
Needs to be just rethought all the way from primary school, right? We were taught about periods, but were we taught about not getting periods anymore?
It was just said menopause will come at 55 or something like that.
Random,
yeah.
You know, even in high school, so even in undergraduate medical school, nothing. In postgraduate, barely anything, like maybe 3 hours of education.
On menopause?
Or for a gynecologist on menopause, right? And it was outdated information. Unfortunately, the medical system just was not taking much interest in the post-reproductive age care of women who are mature and in their midlife. Even insurance says, like, once you've finished having babies, insurance doesn't cover anything.
Right.
We're not covering hormones. The drugs are not even available. They're expensive when they are.
Speaking about insurance and the drugs, can I just ask you a question about the drugs, for example, like they're not currently not covered by any insurance companies. So they are expensive. And that also sometimes I wonder because the women who can access these medications, it's like
they're privileged.
Only the privileged can. So that's why I think it's important also to create awareness about the natural ways of navigating, and also the need as well.
The need for advocating for all these drugs to be available. Women need to they deserve to have the options, all the options available to you and affordable to you, and for you to pick due to your preference and your values, and not be restricted by how much money you make, right?
Exactly.
Yeah.
Exactly. Okay, so do you have anything else to add right now about natural methods of navigating menopause?
No, I think we've pretty much covered most of it.
Pretty much covered most of it. But if I was a patient who comes into to see you, how would that conversation go?
Oh, great.
Yeah. Can we do like a yes, can we do like a mock conversation? Yeah.
So
can we just pretend that
let's pretend.
Something? Okay, so I've come in and I'm okay. So hi. Yeah.
Nice to meet you.
Nice to meet you.
Tell me, how can I help you today?
So I've not been feeling too good. I've been experiencing a lot of insomnia, migraines, and my period has been irregular. Yeah.
Okay, so when you mean an irregular period, what do you mean? Do you have an app you can show me?
Yeah. So my period was like 28 days for the past 20 years. And now I'm getting cycles that come as early as 21 days, 24 days, or 30 days. But it's usually closer together, like 26, 25 days sometimes. Yeah.
And when it comes, is it heavier or lighter?
Much lighter than before.
Okay. Yeah. And do you have a lot of cramping?
Initially, yes, but right now, no cramping at all.
Okay.
Yeah.
And then you mentioned migraines. Did you have migraines even earlier in your life? Do you feel like there was, or is this new to you?
I had headaches, but now they are migraines.
Okay.
Yeah.
And then you also mentioned insomnia. So like, how long are you able to sleep? How often do you experience difficulty falling asleep or staying asleep?
It's erratic. I can't really say, but it's harder for me to fall asleep now.
Right.
And my mind's always racing. And then I'm super tired during the day. And I have difficulty remembering things. And I think that's because I'm not sleeping well as well. Yeah.
Okay. And is this affecting your mood in any way? How have you been feeling emotionally?
I've been feeling like, I've been feeling horrible. Yeah. So it's affecting my mood and my relationship with my team at work and with my family. And I just don't understand what's going on. Yeah.
Any anxiety?
Yeah. And it's never been there throughout my life. I've never had anxiety. I never understood anxiety until I experienced it. Yeah.
Okay.
Yeah.
Any heart palpitations, feeling like your heart is beating really fast?
No, none.
Any weight gain?
Yes. I'm struggling more to maintain my weight.
Right.
Than I did before. Yeah. I'm not really, I'm even exercising more, but the more I exercise, it's just not moving.
Not
right. Yeah. Before, when I'd go harder, it would be easy, like, to get off any weight I've gained. But now it's just not budging. Yeah.
Okay.
Yeah.
Any changes with your digestion? Any
a lot
bloating,
of diarrhea,
right?
Yeah, and random bloating. Yeah.
Okay. Any joint pains or muscle aches?
I get pins and needles.
Okay.
Yeah. Like sometimes I could wake up and my foot is numb. Yeah, pins and needles. Okay. Yeah.
And how is your skin? Do you feel like it's drier than usual?
I feel like my skin is kind of itchy before my period, and I don't understand why.
Okay,
yeah,
right before your period.
But other than that, no issues with my skin.
Okay.
Yeah.
And what about your hair?
My hair is fine.
Okay.
Yeah.
Have we talked about hot flashes? Have you been experiencing those, or night sweats, or cold flashes?
No cold flashes. But I've been getting a rush of heat on my face. Is that what a hot flash feels like?
Yeah, there are many ways that women feel hot flashes. It's different for everyone.
Yeah. So that would be a hot flash, just feeling hot on your face for like a few, not even a few minutes. Sometimes it's just for a few seconds. Yeah.
And like how many times a day does that happen?
It's mostly when I drink wine. When I have a few sips of wine in the evening, that's when I notice that. And then it comes with like some nasal congestion as well. Yeah.
And how is your sex life?
Almost non-existent.
Right.
Yeah.
Is that because you have a low libido, or?
I'm just tired.
Okay.
I couldn't be bothered.
Yeah.
Yeah.
And when you do have intercourse, do you experience vaginal dryness or pain?
Not really. Yeah.
Okay.
Yeah. But the sex life is almost non-existent. I'm tired and angry. I'm annoyed. Yeah.
Okay.
Yeah.
So now I'm going to ask you specific questions to determine if you feel like your symptoms are severe or not.
Okay.
I'm not going to do those now because it's a whole form.
All right. Yeah.
And then, so now let's talk about perimenopause and menopause.
Okay.
It's likely that that's what you're experiencing. But because of your age, it's going to be important for me to do a couple of other tests to make sure there's no other thing that's causing it.
So what tests would you?
So I'm going to do prolactin.
What is prolactin?
Prolactin is a hormone that's produced by the pituitary gland in your brain.
Okay.
It can affect our ovarian function. So I'm going to test that. I'm going to check your thyroid hormone. Our thyroid produces a thyroid hormone. It can affect your ovarian function as well. I'm going to rule out pregnancy. You said you do have sexual intercourse once in a while, and you said you're not using contraception. So let's rule out pregnancy. And then we'll determine the treatment from there.
Okay.
Now, at this point in the consultation, I'm going to give you education on what perimenopause is.
Basically what we've already covered.
Basically what we've just covered.
Yeah?
Right? By the way, these consultations can run 1 to 1.5 hours.
Oh,
it's not a typical gynae consult, right?
So what are the typical tests a patient would expect to have to take if they're coming in to determine whether they're perimenopausal? Yeah. You mentioned prolactin.
First, it depends on your age, right?
Right.
So if you're within the age of... first of all, if you're past 50 or you're postmenopausal, you've already gone 12 months without a period. We're not really needing to do tests to confirm menopause. It's quite clear, right? If you're between the ages of 40 to 45, or rather if you're between 45 to 55, we might do a couple of tests, just depending on how your symptoms are presenting. If we're not sure, if we're not quite sure, if there's something a bit unusual about what you're saying.
Right.
And then if you're a bit younger, like I just said, 40 to 45, we're going to do your prolactin, your thyroid, your vitamin D levels. We are going to rule out pregnancy if you're sexually active with no contraception. And then once we are sure that what you're experiencing is due to perimenopause and nothing else, then we can go ahead and do the treatment. But one mistake we don't want to make is always jumping to assume that what you're experiencing is perimenopause and menopause, even though it seems quite obvious, just to be on the safe side.
Okay, but one thing we need to point out, I feel that is important for the listeners, is to highlight that there's no hormonal tests to test for perimenopause.
Oh, yeah, exactly.
Yeah, because we're talking about tests. So it might be confusing to the listeners.
Okay,
they might take it that, okay, so I can be tested and a doctor would know if I'm perimenopausal.
Right.
Yeah.
So these tests are not to determine if you have perimenopause or not, because that is determined by your age and your symptoms.
And your symptoms, correct.
Because during the menopausal period, it's easy to test. We do estrogen, we do a hormone called FSH.
This is
right?
Post-menopausal.
That's after you've already gone 12 months without your period. If we want to confirm for whatever reason, although it's not necessary. If you're younger and you have these symptoms, we know that your estrogen and your progesterone and your hormones are up and down, right? So I can test you now and find your hormones are perfect and tell you don't have perimenopause. Then I check you like 24 hours later and your hormones are different, right? So we can't use those hormone tests to diagnose perimenopause. We use your age and the symptoms that you're describing to say whether you have perimenopause or not.
So is the reason why there's so many symptoms in perimenopause because of how chaotic the hormones are.
Yeah.
So the hormones are just up and down. Crazy. And is that what causes the symptoms?
That's what causes the symptoms.
Right.
And also your actual cells in your body being deprived of estrogen, right?
Deprived of estrogen.
Now there's estrogen, now there's none, now there's... And then after you've already gone through menopause, the symptoms tend to get a little bit better.
I was about to ask that. So does that mean since postmenopausally, the hormones kind of stabilize or, do the symptoms get better?
They usually get better.
Yeah?
There is some relief.
Yeah.
However, it's impossible to tell how long it will be for you, how long you will have the symptoms. So traditionally, we were taught that these symptoms last about 7 years. But unfortunately, we're finding women having these symptoms for even up to 15 years. So we're not going to be able to tell how fast you feel better.
All right. I love this conversation.
Yeah.
I think it's a call to action for women and for doctors, especially. I like that you highlighted that you did not receive much education on menopause.
Yeah.
So that can also allow us as patients to be a bit more kinder also to doctors. Sometimes, because we don't know. We're just like, you guys are doctors. You should know this stuff. But
but I think it's also fair for if you see a doctor for these symptoms and they can tell that it's perimenopause, menopause, and they're not quite sure what to do, they should also be honest and be like, you know what, let me send you to someone who knows, because I'm not so sure.
Yes.
And so we can work together.
Exactly. All right, great. I think we've pretty much touched on everything right now. Yeah. And I think for our next conversation, we're gonna delve into hormone replacement therapy. I heard it's now called MHT, which is menopause hormone therapy.
Yeah, I'll explain why in the next episode.
Why. Yes. Okay. So thank you so much for this conversation.
Thanks for having me.
I really enjoyed it. I've learned a lot, and I hope you all have too. This is Veronica and Dr. Kenya at the OVA Circle signing out. Bye.